The topic: medical jurisprudence. Medical jurisprudence is the application of law in medicine. Law applied to medicine. That how the doctor should behave, what is the code of conduct for the behavior of a doctor with the other members of the society, with the patients, with other doctors. That is called medical jurisprudence. And what is the reverse? Application of medical knowledge to law. Application of medical knowledge, when that is applied to law for the administration of justice, that is known as forensic medicine. Okay, this is forensic medicine. Alright. So, there are a few terms related to medical jurisprudence. The first one is medical ethics. Medical ethics tells how to deal with the entire society. How to deal with society, patients, paramedical staff, etc. This is a moral code of conduct, moral code of conduct. There is an entire list of what should be done and what should not be done, what are the rights of a doctor, what are the rights of a patient, and if not followed, it is punishable. If not followed, punishable. Okay. Who will punish it? Who will punish the doctors? The Medical Council of India, now presently the NMC, National Medical Commission. Medical etiquette, on the other hand, is a moral code of conduct which tells how to behave with other doctors, with colleagues. And if this is not followed, then it is not punishable. And if this is not followed, this is not punishable. Not punishable. Next, what do we mean by warning notice? Warning notice is a complete list of things, list of actions which cannot be done by a doctor, which cannot be done by a doctor. This list is provided by NMC to any student who at the time of being a complete registered medical practitioner, at the time of that, after completion of MBBS, a list is given and an oath is taken. And this list is always incomplete. Newer terms get on added to this list. So before moving on with the concept of the details of medical jurisprudence, let us know about NMC. What is NMC? NMC is National Medical Commission, which has now been formed after the construction of the Medical Council of India. It is now in place of Medical Council of India, and it has been passed by NMC Bill, which came from 2019. As per this NMC Bill, there are 4 regulatory boards. The entire structure of National Medical Commission, there are 4 boards. Okay, one deals with UG medical teaching, UG curriculum, regulation of UG curriculum, what are the criteria which has to be met. Then PG medical teaching. Okay, details about what are the faculties needed, what infrastructure is needed. Then is ethics and regulation committee. And lastly, education supervisory board. This has the role of looking after both 1 and 2. 3, 4. This looks after 1 and 2, and whether the colleges are sticking to whatever provisions has been laid down by NMC. And ethics and regulation, this is a completely separate part of the entire under the NMC structure, which is dealing with the professional misconduct or any complaints of negligence against the doctors, negligence cases. These are being dealt with by the ethics and regulation. And as far the UG and PG medical teaching is concerned, the NMC has completely restructured it, and now a module called 8Com is being followed. What is 8Com module? This is being followed right now. A stands for attitude. The doctor should have the correct attitude. ET stands for ethics. So the concept of medical ethics has been incorporated inside the curriculum of the present MBBS. so that the students are taught how to deal with the patients, how to break bad news, how to do better communication. These are incorporated into the newer syllabus and communication. And the concept of medical education now is known as CBME. It is no longer curriculum based, it has been modified to become competency based. Competency based medical education. And to establish this and to support in its proper implementation, CISP programs are being done all over India. What are CISP programs? Curriculum Implementation Support Program. Another important concept in NMC bill is the provision of community health providers. Next, moving on to the different schedules of approval of the medical colleges. We have Schedule 1. These are the Indian medical colleges. Their MBBS students are authorized by under Schedule 1. Then Schedule 2. These are foreign medical colleges. The students who are studying in certain foreign medical colleges outside India, their degree is approved under Schedule 2 of and then is Schedule 3. It has got two sub-clauses. A, those not included in Schedule 1, for example, newer colleges, newer institutes, those have not been covered under India Schedule 1. And B is those not included in Schedule 2. Alright. Now going back to infamous conduct. Infamous conduct is also known as professional misconduct. That is, you are doing something which is not at par with the approved norms of being a doctor. Okay, some actions which are not at par with the approved norms or established code of conduct. In this, we have A for alcohol. A doctor cannot perform duties, cannot attend to a patient when he is under the influence of alcohol. That is not allowed. Next A, we have 6 A's. Next A is abortion. A doctor cannot assist in abortion. Next is association. Association, the concept of taking commissions or giving commissions is not allowed. Next A is addiction. A doctor cannot sell or prescribe addiction forming drugs, or he cannot attend to a patient under the effect of an addiction forming drug. Then after that, there is advertisement. Unnecessary advertisement. There are certain regulations for a proper advertisement, and that has to be followed. So there is alcohol, abortion, association, addiction, advertisement. Then A is for adultery. A doctor cannot engage in sexual intercourse with a patient or her relatives without the knowledge of their spouses. Then is B for bribery. This is not allowed. This is a professional misconduct. Then C is covering. Covering means being associated with a medically unqualified person. Medically unqualified or untrained person. Then D is dichotomy or fee splitting. Dichotomy or fee splitting. This is the concept of taking or giving commission or giving referrals. And G is for gifts. Taking gifts especially from pharma companies, is also considered to be a professional misconduct. Now, what is the punishment? What is the punishment if these misconducts or someone engages in this sort of an infamous conduct? The punishment can be initially a warning will be given to a doctor. A warning will be given that he should stop involving in certain professional misconducts. But if the crime is not that much severe. All right, but if it is repeated, then a penal erasure of the name from the register of the registered medical practitioner can be done, and this penal erasure can be temporary. This penal erasure can be temporary, or it can be permanent. And this permanent penal erasure is known as professional death sentence. The doctor can no longer practice as a registered medical practitioner. However, the doctor has the right to appeal to NMC and get this thing sorted, if that is allowed. Then comes the concept of professional secrecy. Whenever there is an interaction between a doctor and a patient, it is a contract. It is a professional relationship where the secrecy of the patient's details and his disease condition has to be maintained. The doctor cannot divulge these secrets to everyone. Secrets about patient, especially patient's confidentiality, should be ensured. If it is not done, then that is punishable. However, there is a condition called privileged communication, where a doctor can, in these privileged communication, the doctor can divulge the patient's details. And the conditions are given by the mnemonic civic sin. What do we mean by civic sin? C is in case of criminal cases. If the doctor suspects that the patient has been admitted after consumption of poison, then this is governed by section 39 CRPC. Intimation to police has to be done. Then we have civic sin. 3 I's, and all these are in interest. In interest to society. For example, if a driver has night blindness, then if he drives, he will possibly commit an accident. So, in this case, in interest to society, night blindness has to be informed. Then V for venereal disease. If a person has venereal disease, then the partner should be informed about it. And if the venereal disease is incurable, even after treatment for 3 years, this will be a ground for divorce. Then I is interest to patient. Interest to patient. If there is any suicidal tendency, then that has to be informed. Then C for court procedures. Court procedures. If the doctor is summoned to court and asks some questions about a patient's confidentiality, some information relating to a patient, the doctor has to abide by the court's law and divulge the information. Then S is for a servant. In case of a servant employer, the employer, if the servant is being brought to the doctor by the employer, then the employer has got the right to know about the patient's condition. Then next is self-interest. Interest to self. To prevent himself or herself, the doctor can divulge certain informations. And last is notifiable disease. And also in cases of negligence cases, right? So in all these situations, the informations of a patient should not be divulged. Rather, in all these situations, the patient's details can be divulged to certain fixed members. Now, the reverse of professional secrecy. In professional secrecy, no secrets are divulged. Okay. There is something called therapeutic privilege. Here, the doctor does not provide all information to patient. Why? To avoid unnecessary fear about the treatment. Suppose prior to taking an operation, a doctor has to give a full disclosure. The doctor has to inform what are the method he will follow, what is the alternate method, etc., and what are the pros and what are the cons of all the methods. But in therapeutic privilege, suppose a patient is old age, he is already having a compromised heart state. So the doctor may keep some information relating to the complications of anesthesia. He may not divulge all the details to the patient, but the patient's relatives may be knowing all these details. So that is therapeutic privilege. Then coming to the concept of consent. What is consent? It is provided by the Indian Contract Act. And a consent is an agreement, mutual agreement between two or more persons. It has to be a mutual agreement, and it has to be completely understood by both the person. Types of consent. We may have oral consent, verbal consent. We may have oral consent. Then we may have implied consent, written consent, and blanket consent. What is implied consent? An example of implied consent is you are listening to me in this video. You are listening to me in this video, and whatever I am saying, you are listening to it. That when you have switched on this video, you have given an implied consent that yes, you will be listening to whatever what I will be teaching. This is implied consent. But when you first install this app, then you have to sign a contract. You have to say that yes, you accept the terms and conditions. That is a form of a written consent. Okay. So taking the consideration into medical field, when a patient goes for examination to a doctor, if the doctor wants to give him an IM needle and the doctor is preparing the injection, the patient just rolls up the sleeve. Okay. Suppose the doctor says that I am going to examine your abdomen, so the patient goes and lies down in the bed, and that the body language itself means the patient is giving consent for whatever the procedure the doctor is going to do. That is a body language that implies that the patient is giving consent. The patient is agreeing. What is oral consent or verbal consent? When the person verbally agrees. Next, written consent. In written consent, the terms and conditions are written in a piece of paper, and the person has to read them and sign that yes, he has understood every terms and conditions in a language which is best understood by him or her, and then he can sign. All conditions are written. What is a blanket consent? A blanket consent is when a person is getting admitted to a hospital. Few hospitals have some forms where they are saying that they are allowed, the person is giving the hospital authority to conduct whatever they want to do, whatever sort of treatment they want to do, they can perform. This is a form of blanket consent, and legally this document is not valid. It encompasses all possible treatment modalities. When a patient is hospitalized, this is legally not valid, and ideally a consent should be taken for each procedure separately. Consent for operation, consent for blood transfusion, high risk consent, anesthesia consent. So all these consents should be taken separately. When is consent not required? The consent is not required in case of emergency, when it is a life-threatening situation. That is dealt by section 92 IPC 911. From 911, remember the emergency dialing number. From 911, remember section 92 IPC. If the patient is in serious emergency or life-threatening condition, the doctor can perform whatever is in the best interest of the patient. He does not need to wait for consent. Another situation is when the patient cannot give consent. Patient cannot give consent. For example, if the patient is unconscious, but some sort of operative intervention has to be done. If the patient is insane and there is no legal representative of the person, then the doctor can go ahead with without taking consent. Then in case of a child, Alright, we will come to details about that later. But if there are no guardians available, then the concept of loco parentis can be applied. And a local guardian and the signature from a local authority, maybe the police, maybe the hospital super, that can be taken. So, based on these things, what is the ideal setup of all these consent? Suppose a procedure has to be done. With a patient. Alright, maybe an operation. So, the doctor has to give full disclosure about it. Full disclosure about what should he disclose to the patient? That what is the exact procedure he is going to do. Suppose a patient has come with complaints of gallbladder stone, okay, cholecystectomy. So the doctor is going to do laparoscopic cholecystectomy. So the doctor needs to say what is the procedure he will be doing, what are the anesthesia, what are the complications, what are the post-operative steps which has to be taken, what are the precautions which need to be taken. Plus, the doctor also has to make him understand that when the open laparoscopic cholecystectomy may be converted to an open cholecystectomy. So, all the details about the procedure which the doctor is going to do, that has to be explained. All the risk factors of that procedure has to be explained, and alternate methods also should be explained. So, procedure and alternate methods, pros, cons, risk factors, everything has to be explained. Based on all this information, the patient may give consent. Or the patient may not give consent. If the patient does not give consent, then that is known as informed refusal. That has to be documented. For example, in a rape victim, when a rape victim has come to emergency department of a hospital, the role of a doctor are the following. Number 1, to provide immediate medical attention to the victim. Number 2, to do a medico-legal examination of the person and to collect the evidences. And number 3, to hand over the evidences to the appropriate authority for further investigation. Now, the patient may say that, yes, I want the treatment, but I do not want a medico-legal examination and I do not want the evidences to be collected and sent to the police. Okay. So, the doctor has to document that, yes, I will be giving only medical treatment, but I will not be giving medico-legal examination and I will not be preserving the evidences. Why? Because the patient is giving informed refusal. Okay. So, when the person has given consent, this is known as an informed consent. That the person has been told all the information that he needs to know, and based on that, the person is giving consent. And this informed consent is considered to be the best consent, and it is taken in a written form. Alright. There are certain IPCs related to consent which have been dealt in details in the IPC in the topic of legal sections. However, the relevant sections are sections 87, 88, 89, 90 and 91 and 92. Out 87 deals says that when an adult person can give consent for all sorts of procedure more than 18. Alright. Out of this, section 91 states that a consent for an illegal act is not valid consent. For example, a patient cannot say that, yes, I give the doctor consent to ampute my limb or ampute my kidney, okay, if that is not indicated. So, if an act is illegal, a patient cannot give valid consent for it. Even the consent is considered to be illegal. Now, the concept of age and consent. Alright, let us assume that a child is less than 12 years of age. In this scenario, the child cannot give consent for even physical examination. So, the consent of guardians is necessary. the guardian's consent is necessary, and this is given by section 89 IPC. Next, the person is a child aged 12 to 18 years. He can give consent to normal physical examination. He cannot give consent to, no consent to X-ray or investigations or per vaginal or per rectal examinations. For doing these things, again consent of guardian is needed. Guardian's consent has to be taken. And if a person is more than 18 years of age, he can give consent for physical examination, for X-ray, for investigations, and also for operative interventions. Alright, this is governed by section 87 IPC. So that is the relation between age and consent. And again, consent cannot be given by an insane person, and consent cannot be given under the influence of alcohol. Okay, so the next concept is negligence. What do we mean by negligence? Negligence means failing to do something. Alright, so what can be something? Either a doctor has to provide a treatment which he is supposed to do, alright, or he can do something which is not supposed to do. So there is an act of omission, right, and there is an act of commission. In act of commission, a doctor does some act which he should not do. For example, giving after operation, the scalpel is left behind inside the abdomen. That is something which should not be done, should not have been done. What is act of omission? That is not giving the care or the treatment which should have been given. So negligence is given as a lack of reasonable skill and care. What do we mean by reasonable? Whatever care or whatever protocol are as per the standard scientific literature. Alright. So what are the 4 D's of negligence? What are the 4 D's of negligence? First is duty. For the condition of negligence to be proved, see what happens. Suppose a patient complains to the court or complains to the medical commission that the doctor has done something negligent towards him. Okay. So the commission has to decide whether the doctor was negligent enough or the act wasn't amounting to negligence. Okay. So for this negligence to be proved, there are 4 conditions, 4 D's which have to be established. The first is duty. The first is that a duty of a doctor-patient relationship, which is known as a fiduciary relationship, was established. That is, the doctor actually owed duty to the patient. This has to be established. Next, the second D is dereliction of duty. That is, lack of giving proper duty. There has been some fault in giving the proper treatment. Okay, some sort of shortcoming is there. This dereliction of duty, after this dereliction of duty, there has been certain damage. Okay, and this damage is as a result of direct causation due to this dereliction in duty. Alright. For example, a doctor performed an operation on a patient. The patient came with pain abdomen, and he had appendicitis, so appendicectomy has to be done. So doctor performed appendicectomy, and after appendicectomy, even in spite of that, the patient still complains of pain abdomen. On doing investigations, it is seen that the doctor has left gauze pieces inside the abdomen. Okay. So here the duty has been established between the patient and the doctor when the patient has come to the doctor to be examined. Alright, duty has been established. Duty has been done, which is the operation. But while doing the operation, the doctor has committed a dereliction by keeping the gauze piece inside the abdomen. That is something which he should not have done, but he has done it. So it is an act of commission, doing something which should not have been done. Okay. Then there is damage. The patient is still complaining of pain abdomen. Okay. So there is damage. And this damage, this pain abdomen is as a result of infection, peritonitis due to the left gauze piece inside the abdomen. So that is when the dereliction of duty is directly causing this particular damage. Now, if there is loss of life, then this negligence will be termed as a criminal negligence, or if there is a loss of limb, amputation has to be done. Okay, then that amounts to criminal negligence. Whereas if the negligence can be sorted, can be addressed by only paying monetary damage, then that is known as civil negligence. So what is the basic difference? Let's first know about the different types of negligence. What are the different types of negligence? Civil, criminal, contributory, and corporate. Alright. So let us see all these negligences one by one. Civil negligence. For example, what do we mean by civil negligence? Giving a wrong medicine, prescribing a wrong medicine, prescribing a wrong prescription. Okay. Damage which is not amounting to death. These are civil negligence, and these will be tried in a civil court, and this can be settled by paying monetary compensation. Here the burden of proof that yes, the doctor has committed some sort of negligence, the burden of proof lies with the patient. And if he proves that the culpability was more than 50%, the culpability, the negligence, the quantum of negligence which has to be proved is not as high as that in criminal negligence. Okay. The quantum of negligence which has to be proved is less. Alright. And next is criminal negligence. What is criminal negligence? Criminal negligence is something which produces the damage or death or amputation, and these are tried under criminal courts. So in criminal negligence, the doctor is tried for the criminality in a criminal court. Okay, and we will come to that later. And he is also tried by MAMC for regarding the culpability of the lack of exercising proper reasonable skill and reasonable care. Now here the term reasonable skill and reasonable care is very important, and it also depends on the infrastructure which is present with the doctor. Suppose a patient who is having pain abdomen, who is having appendicitis, he has gone for a treatment to a doctor who is an MBBS doctor and who is performing examining the patient in a district hospital which does not have facilities for laparoscopy operation. So he will give the patient that much cure or that much treatment which is possible for him to give in that infrastructure. Okay. And suppose the same patient has gone to a specialist, an MCH gastrosurgeon in a corporate hospital which has the provisions of giving a laparoscopic operation. So that the standard of treatment which has to be given will be set at a different level for this other scenario. So the standard of care which has to be maintained, it will depend on the situation. Okay. So, but what can be considered to be criminal negligence? Such as doing operation on wrong limb, left in place of right, then abortion, then organ trafficking. Okay, these will always be considered as criminal negligence, and always there is some part of civil negligence associated with criminal negligence. Always some sort of monetary compensation is asked by the patient associated with criminal negligence. Now we need to know about this term, reasonable foreseeability. Okay, what does this mean? While providing care to a patient and while prescribing drugs, the doctor should see that what are the complications which can occur. Okay, and if the reasonable foresight is not present, that may be considered to be negligent. For example, a patient is supposed to be given a dose of penicillin or any other antibiotic. All right, and before giving the antibiotic, testing is done. Okay, to check if the patient has got any anaphylactic reaction to that particular antibiotic. Now, suppose a patient is given an antibiotic injection and within a few minutes the person dies. Okay. Here, if the person dies of anaphylactic shock and if a test dose was not given, okay, suppose the injection was directly given. If a test dose was not given and the patient dies of anaphylactic shock, then due to lack of reasonable foreseeability, the doctor will be held responsible. But for example, if postmortem is conducted in this particular patient and it is seen that the death is not due to anaphylactic shock but due to certain other reason, okay, and then the doctor is not held responsible, right? So the doctor has to foresee the consequences of treatment and follow that. All right. Here, what will happen if a doctor is doing something which is negligent? Criminal negligence. What are the sections under which it is punishable? If criminal negligence, if due to this negligence the patient dies due to a rash and negligent act. This is a rash and negligent act. If the patient dies, the doctor will be punished under section 304A IPC and he will be punished with 2 years imprisonment plus fine. What if there is some hurt? Okay, the patient is dying here. The patient dies. What if the patient only gets hurt? There is some hurt due to this rash and negligent act. It is tried under section 337 IPC and punished with 6 months imprisonment plus minus fine. If he gets grievous hurt, then that is tried under section 338 IPC and punished with 2 years of imprisonment plus minus fine. If the patient has, there is spread of disease, due to this rash and negligent act, that is tried under section 269 IPC and punished with 6 months imprisonment plus minus fine. And if it was a malignant act, if it is a rash and negligent act, then that is 6 months. And if it is a malignant act, it is tried under 270 IPC and punished with 2 years of imprisonment. Alright. So that are the criminal acts which are in relation with this rash and negligent act. Now, what is contributory negligence? Contributory negligence means here the patient, the net damage, the effective damage which has occurred, that has occurred due to the negligence of both the doctor and the patient. Okay. Suppose a patient has come with history of fever. Okay, a patient has come with the history of fever and doctor prescribes him to have paracetamol tablets. Okay. Now he forgot to mention how many paracetamol tablets per day and for how many days. He forgot to mention. Okay. So there is some negligence on the part of the doctor. Now the patient, after taking the prescription, he takes one single dose of paracetamol tablet and after that he does not have any other tablets. And then he goes on to the fever increases and he has convulsion and he gets admitted to the hospital. Alright. So here there is some sort of negligence in both by the doctor and by the patient. Both are guilty. Okay. So negligence by both patient and doctor. This is considered to be a reasonable ground in only civil cases. This is approved. This is accepted by the court only in civil cases, not in criminal cases. There are two doctrines. One is last clear chance doctrine. That means that the doctor had one last chance. The doctor had one last chance to make the patient follow his instructions. But he has not exercised this last clear chance. There was one last clear chance when, if the doctor had intervened, then the resulting damage would not have happened. But the doctor did not intervene. And avoidable consequence rule, this is in part of the patient, where the consequences could have been avoided if doctor's advice were followed. Doctor's advice were followed. This is the avoidable consequences rule. Now coming to the defenses against negligence. When a charge of negligence is brought against a doctor, then what are the defenses which can be applied by the doctor? What are the conditions when it is not considered to be a defense at all? It is not a defense. This is known as res ipsa loquitur. It literally means thing speaks for itself. For example, leaving a scalpel inside abdomen after operation. What does it mean? That if a doctor has performed something which is so grossly negligent that he cannot have any defense after doing something which is so grossly negligent. If a doctor performs an operation and leaves behind a scalpel, and if the patient has any further pain abdomen or peritonitis due to this, then the doctor cannot defend himself. This is known as the thing speaks for itself, or res ipsa loquitur. This is common knowledge that whatever he has done is that much negligent. Next is the concept of partial defense. Partial defense. When can the partial defense be allowed? When there is the concept of contributory negligence, as explained below, as explained above. Then the third situation is, what are the conditions which can be taken as valid defenses? Well, what are the conditions which have to be satisfied for there to be negligence? The 4 Ds have to be established: duty, dereliction of duty, damage, and direct causation. So the first ground is if the 4 Ds have not been established. If the 4 Ds have not been established, if it can be proved that the doctor did not owe duty to the patient, if it can be proved that the doctor-patient fiduciary relationship was not established, if it can be proved that the doctor gave reasonable amount of care, exercising reasonable amount of skill, in spite of that something happened, then there was no dereliction of duty. Then it can be proved that the damage which has happened is not entirely due to this lack of exercising proper skill, then all these are taken as valid grounds for defense against negligence. Then we get the condition called res indicata. Res indicata means there is a period of 2 years after commission of some negligence by a doctor. After negligence by a doctor, there is a maximum time limit of 2 years within which the patient has to complain to the state medical council. Okay, this is known as the limitation period. This is known as the limitation period. It has been asked in the exam. So there is a limitation period of 2 years since the date of commission of the negligence. If the patient does not file a case within these 2 years, then the doctor cannot be charged with the same thing again. Okay. Now, what happens? A patient complains initially to the state medical council, and the state medical council may award punishment to the doctor. If that happens, then the doctor can appeal. Doctor can appeal to Central Health Ministry. Central Health Ministry. And that is then sent to the Regulatory Ethics Board of MAMC. And this entire process, it has to be completed within 90 days. Alright. Next, res judicata. This means let the thing rest. If a doctor has been tried in a lower court, if case has been tried in a lower court, for example, in a sessions court, case tried at, this is about the criminality of the punishment, criminality of the action we are saying, case tried in lower court, for example, sessions court, the same case cannot be taken up at a high court again. Okay, if the decision has been given by a lower court, then the same court cannot, the same case cannot be taken up at a higher court. Alright, this is known as the catch-22 situation. This is known as the res judicata. Then there is misadventure. In misadventure, the doctor tried to do something, the doctor tried to give a mode of treatment which was not which was not as per the standard scientific literature, but the treatment modality which was given, it resulted in some sort of misadventure. The doctor did not have any intention to hurt the patient, right? No intention to harm the patient. Here we need to know few terms. One is beneficence. The doctor will always try to do benefit for the patient. All the acts will be in good faith. Then non-maleficence. If the doctor cannot do good for the patient, he will not try to harm him. That is known as the concept of non-maleficence. Then is autonomy. The autonomy of the patient should always be respected. If the patient, in case of a cancer patient, suppose the patient is saying that I do not need any operative intervention, I want palliative therapy, then that should be respected by the doctor. If it is not respected, if the doctor does not pay heed to the autonomy of the patient, if he wants to impose his decision, then that is known as paternalism. Paternalism, and that again can lead to negligence. Okay. And another medical maloccurrence. Medical maloccurrence, this can be at the level of therapeutic maloccurrence while giving some medication. It can be at the level of investigational maloccurrence, and there can be an error of judgment. There can be an error of judgment. Products liability. Suppose an operation is being done, and while doing the operation, there is some defect in the machine which was being used. There was some defect in the diathermy machine, and as a result, the patient got burn injuries. The doctor was responsible, but along with the doctor, the company who is giving the diathermy machine and the people who are supervising whether it is functioning correctly or not, they are also responsible. So this is known as products liability. Okay, that liability for faulty products or machinery is not on the doctor. The doctor is not responsible for if a machinery does not perform its role properly. Then doctrine of common knowledge. If it is known that whatever the doctor is doing, that is common knowledge that yes, this thing should not be done, then that is a ground for defense against negligence. Doctrine of calculated risk. The doctor is taking an operation. Suppose a pregnant female has come with maternal distress as well as fetal distress. So the doctor has to assess if doing the operation he can save any one of them, maybe the child or maybe the mother. So he has to take a calculated risk. And if while doing the operation, suppose the child dies, then the doctor cannot be said to be negligent for that, because he had taken that risk and he had established that risk. So communication, very important term. Communication of whatever process the doctor is trying to do, that has to be properly communicated. And another important term is documentation. Proper documentation of whatever steps are being taken has to be done properly. Novus actus interveniens or act of God. if the negligence was on some part, but if somehow something new act happened and as a result the patient got injured due to that particular new act, then that is known as novel actus interveniens, act of God. For example, a patient is being shifted from one hospital to another hospital by an ambulance. The patient needs an urgent operation. The facility is not available in that hospital. The patient is being shifted to another hospital. Now, on the way, the ambulance has a road traffic accident and the patient dies. The doctor is not responsible for this new act, which is breaking the chain and coming in between. Okay, doctor is not responsible for any new situation which arises and which is not as per the normal course of action. Corporate negligence. The hospital system setup can be held liable or can be held negligence if there is some fault in the part of paramedical staff, or some fault in the part of other departments. Okay, and if, for example, the patient is staying in a bed and the fan above the bed, it suddenly falls and hits the patient and the patient gets damaged. For this thing, the doctor is not responsible, even if the patient has any injury. So, any fault in infrastructure. Then there is a term called composite negligence. What is composite negligence? Suppose a patient is being examined, is being referred. A patient was hospitalized with pain abdomen and the patient was initially admitted under a surgeon. Next, investigation has been done and it has been seen that there is some urological problem, some endocrinological problem, some medical problem. So, a lot of referrals have been done and finally the patient is being treated by a team of doctors. So, whatever negligence, if somehow there is some negligent act, then whatever negligence happens, it will be as a responsibility of all the team of doctors. Okay, only one doctor will not be held responsible for that. And in corporate negligence, the corporate is liable to pay the damages. Liable to pay the damages for the negligence. Next, we move on to the concept of vicarious liability. Vicarious liability is a valid defense in case of civil negligence. It is not considered to be a defense in case of not in criminal negligence cases. Alright. What is vicarious liability? That a doctor is not always only responsible for the negligence which has occurred against the patient. Okay. It may happen that the master is responsible. Respondent superior doctrine. Doctrine of respondent superior, this is known as let the master answer. Another concept of this is borrowed servant doctrine. When an employer has been borrowed. And then there is a concept of captain of ship doctrine. The leader has to take responsibilities. This concept of vicarious liability is also known as the deep pockets, doctrine of deep pockets. Okay. For example, suppose an intern is doing blood transfusion and an intern is doing dressing. Okay, there is an orthopedic patient, a fracture, an operation has been done, and after that an intern is doing dressing. The intern is not doing the dressing properly, and as a result the patient has infection and there is gangrene of the area. Alright. So, the person who is directly responsible here is the intern, but his action should have been supervised by the superior. For example, by the junior resident or the senior resident or the assistant professor. So, these are the people who are also responsible. So, the act of a junior should be supervised by a senior. If that supervision has not happened, then not only is the particular person responsible, but a share of responsibility is also carried over to the seniors. Next, borrowed servant doctrine. Suppose a doctor is performing an operation and a nurse is assisting him. While doing the operation, the nurse does some faulty maneuver and the patient gets harmed. Here the nurse is guilty, and because the nurse is being employed by the hospital, So the quantum of negligence does not entirely go to the doctor. Some quantum of negligence also gets imparted on the nurse, and because he has been borrowed by the doctor, by the operating doctor from the hospital, so the responsibility falls in the part of the hospital, right? So nurse, doctor situation. And captain of ship, suppose a fault has been done by a junior faculty, then the head of the department, then the particular head of that particular unit also has to take some responsibility. So the concept of vicarious liability is basically to prevent all the share of negligence going on to one particular doctor. Whatever negligence is there, some portion of it is allowed to be shared by the immediate seniors. After the topic of medical jurisprudence, let us just cover one small topic, that is declarations. There have been several declarations at several important places, and all of them are related to some important thing which is related to medical jurisprudence. The Declaration of Geneva, G, it has modified the Hippocratic Oath. Okay. Then Helsinki. Helsinki is dealing with human experimentation and clinical trials. Experimentation and clinical trials. Then Hong Kong, O for old patients, the right of the old patients. Then Istanbul writes about the documentation of torture has to be done properly. Then Lisbon gives a list. Of, that is the right of patients. It gives a list of the right of the patients. Then Malta says whether a hunger strike person can be given force feed, whether a person can be given malt forcefully. So that is a hunger striking, force feeding. This concept is given by the Declaration of Malta. Then Oslo is for abortion, what has to be done in cases of an abortion. Then Ottawa is for child health rights. Then Sydney, we all know Sydney is death, it declares death. Then Tokyo for torture. All these have been asked in the examinations. Okay, then Venice, V, it is dealing with end of life care, terminal stage care. Okay, in Washington, and it deals with biological warfare.